So, good afternoon, coaches. Welcome you all for another amazing case presentation session by Neelam, Dr. Neelam. So, she is here today to share her story with the client who was suffering with diabetes. The first thing was the weight, too much of weight, and predominantly iron deficiency. So, today she is going to throw some light on how iron profile is very much interlinked or integrated when it comes to weight management, right? Over to you, Neelam. Please go ahead.
Screen is visible?
Yes, yes, yeah, it's clear.
Great. Hi, I'm back again with yet another case, which is very, very simple if we talk in terms of weight loss and diabetes. But why I chose this case is because with this case, I could study three things which were really making me go crazy initially. So the major thing that I got to know is this lady. She had been overweight. She had been having a back pain, and she had mild diabetes. Like 6.5 was her HbA1c. But when I checked her iron levels, which was a random study, she got that iron profile to be taken care of with that package they usually get. So in that, we could see that her hemoglobin levels were absolutely fine. Her WBC and RBC count was absolutely okay. The only thing that was different was that her UIBC and TIBC levels were low. Okay. So I wanted to actually study what does this ferritin, transferrin, UIBC, TIBC stands for. Okay, while studying that part, I wanted to discuss this so that even we get a brief update on what exactly these parameters would work and how would they work for us. So that's how the case is about. Okay, so let's go with the case study and then we'll discuss this ferritin wala thing, and later on we'll discuss what kind of modifications we did for her. Okay, so the case is about high sugar, low iron, where the body is giving her mixed signals. Sugar is there, she is feeling fatigue and everything that is there. The present complaint was that she had had lots of fatigue, she had back pain, she was unable to concentrate on her day to day work, she was unable to sleep okay because she was having a severe back pain. So she was not even able to sleep properly on her back. That was the complaint she came from. Okay. Another interesting story. How did this case came to me? I had treated her son, who was like 17-year-old, in her age. This 17-year-old when he was studying in school. So that time we treated this guy, and I had presented his case also. That is the most interesting part. This guy told her mother to come and talk to me rather than going to the doctors. Usually, parents come for their kids to be treated. In this case, her son pushed her to get treated by me. So that was another interesting thing here. Okay, so I would directly go to the profile. She's a 46-year-old female, height 5 feet. When she came to me first, her weight was 83 kgs. These are the ratios. The chest was 105, 109 was belly, and 121 was a butt size. ठीक है, her hemoglobin like HbA1c values were 6.3, hemoglobin was 11, but this was something that was alarming, that her UIBC, which is called unsaturated iron binding capacity, that was high comparative to the normal range, and her transferrin saturation was low, which made this case very interesting for me. So she was very sweet on the outside, but she had a very weak inside, right? Okay, so what we did with her is, I am unable to share. Just give me a second. Yeah, okay. So the complaints were weakness, fatigue, shortness of breath, high sugar, low hemoglobin, back pain, and this was because They had a very horrible dietary habits, as in like they are mostly eating from outside, no inside food. Then they were having this problem of high carb, no proteins, a very sedentary lifestyle. She was overstressed being in a joint family. She had very irregular sleep habits because of her she has her husband, son, father, mother-in-law, and a sister-in-law staying all together. She's always taking care of all these things. Another thing was that they are socially very connected, so they have lots of people coming in and going out of their family. Okay. So, how we approach this case is that we were not only focusing on the sugar, that was not my major concern. My major concern was back pain initially, just taking care of the chronic back pain and inflammation, which was low because eventually, when we got to know about the ferritin, that inflammation also went. Then she was eating usually okay. In this case, another thing was very good. This lady, what she used to do is she used to cook food for her family members. But like for example, she's cooking palak, spinach these days. So one katori for everybody. What she did is she used to miss eating that because the family members used to take more. So she was left with no food for herself. So either she would skip the meal or she would order from outside whenever she felt hungry. That was a major drawback she had had. So that is why everybody in her family is healthy, only she is suffering from all these problems. Okay. Okay. So so far it is just the case. Please let me know if there is any questions, because then I would go directly to the iron profile part of it. Any questions so far related to this thing? Anything you want to know about the case per se? How we treated, what we treated would be a different story.
I feel Neelam,
Yeah,
you can
Neelam, ma'am.
continue. You have
Yeah,
talked,
the
Neelam.
stress levels, like what type of stress she is having.
Okay. The stress for first she had was about her son's job. He's recently got a job, but that is a very time consuming job because he has to travel for 2 hours per day, like a one way. So 4 hours per day travel. So till the time her son is back, she's not able to sleep properly. Again, a joint family, multiple people coming in, which is very erratic. So she was most of the time spending in the kitchen. So that was another stress that she had had. Okay, there initially just one. Her husband was working. Now her son has started to work. So the financial crunches was also there. So three major stresses she had.
Okay, Neelam.
Thank you. Any more questions? Okay. So now I am going to tell why we start. I focused on UIBC, TIBC, and ferritin. That is the major story that I wanted to share today. The point is, when we are talking about iron, it is just not the iron per se, it is the protein that carries the iron also, right? So we know that our body takes iron from the intestine. The whatever food that we eat, we get that absorbed by the intestine, so iron goes into the blood. Here, the transferrin protein binds with the iron and takes it to the liver, where then finally iron is stored. That is one place. Second place, that iron along with transferrin is taken to the bones, where all these red blood cells are generated through the bone marrow. The long bones we are specifically talking about. Once that is done, all the red blood cells are taken up to the kidney. The iron is released and the debris is flushed out. And again, iron is reabsorbed by the blood. And again, transferrin is the carrier. So far we are clear on this part, how the iron metabolism happens. Okay.
Yes,
So
ma'am.
once that is done, the ferritin is the iron part, which takes up oxygen, making it hemoglobin, and then giving it to different body parts. I hope that is also clear. The cell body taking up ferritin and oxygen. This is how it works. Now, in the blood cell or in the blood, we have iron binding molecules which are available on the cell structure, which is called the total iron binding capacity. In case there are some unbinded molecules left, they are called unsaturated iron binding, right? So in her case, her iron was not a problem. Iron binding capacity was not less, but still the transfer in the protein that carries the iron was less. So the problem was not typically with the iron, but the protein intake of it. Right? That is why the unsaturated molecules were comparatively more in her case. This is a real study that we have from this particular female only. So the transferrin was lesser. That is why the unbinded or unsaturated iron were more. Any doubts till this part? Okay. So now what we did with her was we never gave her a iron-rich diet per se, but technically we increased the amount of protein in her diet. Second thing, we gave her the diabetes specified herbs, which helps in reducing the sugar values. Just by doing these two things within a week time, her back pain was reduced without any medication, and her not HbA1c, just the sugar values were dropped from 250 to 150 just by doing these two major modifications in her diet. The normal local machine that we do at home, the glucose monitoring thing, we only use that to get to know this. Just to add this, I have added the real schedule that I have given. So you can see I had given her Triphala. Triphala is a simple herb which I use for all my diabetic patients. I had converted her night meal with a misi roti, that is that besan based roti, rather than having a normal gehu or normal atta. I had changed her lunches to sprouts or brown rice. Okay. And the meal time which she used to have at 11, we have just changed it to 9 o'clock. Right? Other than that, only that black tea was added. And she was doing 30 minutes of walk in the evening time and 20 minutes of walk at the night time. Since she could not go for a longer walk, that is why we introduced stair walking for her also. Okay. And obviously, if she's eating at 9, she's easily able to sleep by 11. So within 1 week, we have just done these 4 modifications. Given Triphala, given her black tea, changed her eating, and given her walks. Okay. So this is the result that we got in a span of 3 months. From 83, she's 73 today. This is today's data, if you can see. The chest size from 105 is reduced to 97, belly from 109 to 97, and butt size 121 to 110. And this is how she looks today. I have a call with her and I'm about to have her reports by evening. So I would share that also with you guys. Okay. So the only thing that we did was you can heal your life without a single medication. मतलब her husband was so keen on, मैम आज इसको शुगर का दवाई दे देते हैं, बिलिप्सा दे देते हैं, मेटफॉर्मिन दे देते हैं, we can give this. He was after my life. I said, give me 3 months. If you don't see a change, give her whatever you feel like giving. I have really no issue. So still the work in progress because we are still to reduce her belly size to 90. So 7 centimeters more to go. That's roughly 3 inches. So another 2-3 months and we would have another beautiful. Acha, the best part is she's not having a back pain. This is September thing when she was walking double stair walk, like she was doing 8 fleets, so 16, 32 stairs only. One. Now she can walk 6 floors, one shot without gasping. Okay. So more aware, more disciplined, consistency. That's the major thing that we achieved from this particular case. So guys, just one request, whenever you are taking any case, just read all the blood work that you are given, because just one parameter does not define this particular person. I never focused on sugar values. Good to go? Questions? Am I audible?
Yes, yes, you are. So
Yeah.
I was
Okay.
waiting someone want to talk. So okay. So
No,
first thing
no
is
question.
like,
Yeah.
Rupa, you want to talk?
No, no, I said I'm clear with her thing. Ki I like the presentation, her talks. So I'm thinking when I will start this way. Okay, you can continue.
Thank you, Rupa.
Yes. So basically, when we look into the we conclude with hemoglobin level for iron profile, but of late it is not so. So iron profile has all these parameters. Whatever you said, I'm not adding anything. I mean nothing else to add anymore. So UIBC, TIBC, transferrin, iron, and then hemoglobin. All things are like we have to have that clarity. The difference between the iron, the hemoglobin, the transferrin part. So this is really what's a very profound way of explaining things, especially when it comes to iron profile, and that too connected with all the other clinical thing. So one question, as yes,
No,
yes,
no,
Neelam,
just
please
saying,
proceed.
one very interesting part was that in spite that she's 47-year-old and having a menstrual regular.
Wow.
So that was another surprise. And then that is why I went into this part. Then why is she having this problem? So that was a major thing that I had in mind.
No, when the other day we were discussing about, I really want you to throw some light, like how you were able to overcome the practical challenges where she is in a joint family, making her understand, no, you have to eat on time, you cannot wait till 11 p.m. for your dinner, please finish it off by 9. It's very very challenging to convince a homemaker, right? And that too, she's been used for that kind of practice for years together, and they always come up with their own story, right? So I would
Okay.
like to hear that.
Yeah, thanks, thanks. I forgot. There were two things that I really wanted to discuss again. Okay, guys, there are two studies again, not seen anywhere. One thing what I had seen is the place which is more vulnerable is the place that is controlled by that particular spine, right? Say, for example, you have a shoulder problem. So a spine that is on your neck is always having a like you have your vertebrae. So the two vertebrae of that area would be squeezing your nervous system, and that is why that pain would radiate into your shoulder. In her case, there was the lumbar spine, like the S8, the eighth vertebra on her middle back was always having a problem. That is why she was having severe back pain. The time her posture was erect, like her posture was bent, so her these vertebrae were squeezing out. Right? The time her posture was straight, the pain automatically went.
Neelam, could you
Now,
please share that screen, the before after pic? Probably the
yeah,
posture
yes,
would
yes,
be
yes,
more
yes,
visible.
yes, yes, sure. Okay, so guys, this thing that we are working on. Okay, can you see this particular image? In this, her spine is bent. It's forming an arc. And this was the place where she complained of having a pain. the time her belly started to reduce, the posture was erect, and that is how her pain started to subside. So when your vertebrae are collapsing, your nerves is pressed, so that particular area would be more prone to having pains. Once you take care of that area, you would understand that pain is gone. Now, even in that area, all your organs are there which are controlling your digestion, the liver, the stomach, the intestines, and duodenum area. So, if that spine, if that nerve is released, the organ starts to work properly, right? And you tend to get the results. So, identify which area. Say, there was another case in which this area was having a pain. So, what I had seen is that her bust area was more prominent. Her bust was somewhere around 120, right? So she had a pain here. Now the pain caused the bust area to increase, or the bust area caused her back pain to increase. I was not sure. But eventually these two things are linked. So if you can identify that, you can easily take care of the pains and reduce the sizes, both together. Okay. So this was one thing that I could study from this lady. Another thing that I could study is I did not ask her to change much. I just asked her, okay, you do not have anything at home to eat, but carrots, tomatoes are something that are readily available in your kitchen. So what you go do is go grab a carrot, eat that. You don't have anything, okay, great. You have dates at home, just go grab that and eat it. So she was not even drinking water properly. So what I did is I asked her to put 3 to 4 dates in her water and drink that water. So by just taking those dates, also the iron content of her body was increasing. Right? Just by eating jaggery. Jaggery is one thing which is usually available during this winter time in North India. So just eating a small piece of jaggery would give you iron and folic acid. So even that would have helped her with this part. She used to eat makhanas, right? So, but what she was doing is she was frying those makhanas. So we asked her not to fry it, just roast them and consume that with 100 ml of milk. So if you see that I had given her the diet, in that I have given her makhana also. In this thing, see, I had given her milk and this sesame seeds. I had given her coconut. I have given her singara. Singara is nothing but this water chestnut. So these were given for the purpose of increasing her calcium, reducing her intake of random snacks, giving her healthy snacks just to enhance all these digestibility things. Okay. Now people say that for the sugar patient you should not give milk. But see, all these consecutive weeks I had given her milk twice, once in the morning, then in the evening time also. So milk is not the culprit. What you're consuming with milk is a major part that is taken care of. What she was doing is she was taking milk and taking biscuits or rusks with it. So rather than that, we have just switched her to either having sesame seeds or roasted macanas. So even that helped her with her hunger pangs. In the night time, if she's not able to take anything, then I just ask her to go and grab a carrot, eat it, and sleep. So even that helped. I hope, Ripti, I answered that question.
No, the meal timing part.
Right. Again, that's what I said. That I had requested her to, if she can't eat anything prior to the family members. Initially, the thing that I asked her is to eat whatever she can, but before 9. Only that timing change we did. I have not changed the breakfast part. I have not changed the dinner part. I just requested her to have her meal 30 minutes, 2 hours prior to her sleep time. And whatever she does, she just have to go down for a stair walk. Even if she can't walk, just 2 or 3 floor stair walk. That's that. So initial changes were small. Eventually, she could manage more time because she had more energy to walk. Right? So that's how the changes were done. So one change or two changes per week. was the criteria for. And by now she's all taking care of everything. Even the this as I said, at 11 o'clock was the time when she used to have dinner. So she started feeling hungry at that point of time. So what we did is we said, okay, you have it something at 9. Keep a bowl of sabzi for you, and if you want, you can have just the sabzi at night time, which she never took. But yes, that was there for her. So we did not deny her anything. We just asked her to take care of the timings first, and then we can easily change the things. Guys,
Thank
any more
you.
question?
Let me check in the chat. Is there anything? No questions in the chat as well.
Huh, ma'am.
Yes, Prabhala.
Ma'am, tell me about that Tripala. You said no. So for all diabetic patient, you will give. So how it help, ma'am, for diabetic?
Okay, Pramila, understand two things. This harad, bahir, and amla are the three fruits that are present in Triphala.
Okay, ma'am.
All these three fruits combined together or given separately, they act as pseudo insulin.
Okay.
Not just this, even there is one thing called isabgol, the this powder, the digestible powder that we take usually.
Ma'am,
Yes,
psyllium
Uh,
husk.
Psyllium husk.
Psyllium husk.
yes,
Okay,
sir.
so these two, three things are very rich in fiber.
Okay.
And we know that fiber always reduces the sugar content of the body.
Okay.
Like they help, more, like unsoluble fiber is always something that we recommend to all the diabetic patients.
Yes, ma'am.
Just because of their pseudo insulin property, they help me with all these things.
Okay. Okay.
Not just that, even taking black tea,
Mm.
it also helps with the absorption of sugar more.
Okay.
Okay, so that's why this is given to these. Another thing, because of this, she started to take more water also.
Mm. Oh,
So,
okay.
say for example, she was consuming 3 to 4 glasses or 6 glasses of water, adding
Mm.
these things after every meal. So, we added 3 glasses of water more. So, her water intake eventually went up to 9 glasses. So,
Okay.
taking water more also helped her.
Okay, ma'am. Okay. Thank you, ma'am.
Thank you, Pramila.
Good
Yeah.
afternoon, ma'am. Ma'am,
Yes,
Srishti
Srishti.
here. Ma'am, I wanted to ask that what I have heard, though I'm uneducated about the Ayurvedic side, but I have heard that there are many ways of making trifla, or it is a particular recipe of trifla.
Srishti, Triphala is usually available. I mean, what I had given it to her was usually available. But how we make it is that we take all three herbs in equal proportions, mix it with water and take it. So you want
Okay.
to have individual herbs and mix it. You want to have a already prepared concoction. We are good to go with that. It is totally up to you. But all the three herbs has to go in the equal amount, equal proportion. 1:1:1 ratio.
Okay, ma'am. And ma'am, what do you recommend taking tripla for the diabetes? It is individualistic, or it is a general way of taking tripla for every diabetic?
Srishti, so far what I have studied is people have diabetes and then they start having their medical conditions. So for all those cases, we would recommend Triphala. But in case somebody is having some other medical condition first and then diabetes eventually happen, then we would not recommend. Say for example, somebody has a high blood pressure and then sugar happened. So for those cases, we would not recommend Triphala. A person who is having IBS condition and sugar, then we would not recommend Triphala. Somebody who has osteoarthritis, I would not recommend Triphala because Amla is a very bad herb for a osteoarthritic person. So it is a case to case thing on a very short term note.
Yes. Okay, ma'am. Thank you.
Okay. Because IBS case also you would not give lots of fiber. that would trigger
Yes,
her
ma'am.
IBS. So we would not.
Yes, ma'am. Ma'am, what I was, studying in I mean, in a paper about Ayurvedic, that there are 99 ways of taking triphala in different kind of diseases.
Agree, 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 agree.
Hi Neelam, I have a question
Hi,
about this
Shweta.
amla.
Mhm.
Yeah. See, I have osteoarthritis, but I take lot of amla, that is intuitive because I feel like taking, so I take amla. So in that case,
Right.
what do we do?
Srilata, then Amla taking, okay, we are again going to the Ayurvedic part. See, Amla technically has a sour flavor.
Yeah.
In spite of calling it as a balancing herb, it usually being a sour herb increases your acidity in the body, right?
Oh, okay.
So the only thing that is least acidic or alkaline is your bones.
Mm.
So to balance out your acidity, the bones would be resolved.
Okay.
Okay. So that's how you get. So now, what is a remedy? What we do is we make amla candy. We boil it or
Yeah.
steam amla, add some amount of sugar syrup and some amount of black salt or pink salt, and then you can
Yeah.
use that as amla candy as your remedy.
Okay.
Okay. So you can just change the potency of amla.
Yeah. Sure. Thank you.
Okay. Great.
Neelam, in addition to that, even I was about to ask. So one is that this client was also having this bone health issue, right? I mean, you were including more of calcium.
Not because of the bones, because her magnesium, calcium, and every other part was okay. The only problem was the back pain.
Back pain.
So the muscles was weak, not the bones per se. As we discussed that her spine was bending, so that is why she was having that back pain, and it was more of nerve pressing,
Pressure.
not
Okay.
the bones.
Right. And one more thing is like generally sugar as per Ayurvedic, it is acidic in nature, right? No?
Sugar is alkaline.
Sugar is alkaline.
Sugar, okay. Sugar has more of cooling properties. If you take any carbohydrate rich food or any sugary food, that would cool down your body. Say for example, when you have this thing IBS, so what I give is gulkand. Gulkand has a sugaring property, so that has a cooling property. That is why all my IBS people would definitely have gulkand. Sugar has total cooling property. If you drink glucon D, right? In glucon D, whenever you have glucon D, you have a very cooling property. Your mind relaxes. So please go ahead.
There are two ways to look at iron and iron-rich foods. Okay, especially when it comes to glucose. Biochemistry-wise speaking, anything that contains sugar, okay, whether it is dextrose or hexoses, riboses, I mean, like 5 carbon sugars or 6 carbon sugars, anything that is glucose, okay, or sugar is acidic in nature. But the way Neelam explained when she said alkaline, so she is talking from the perspective of an Ayurvedic prescription. Okay, both should not get, you should not get confused. See, she is well versed in Ayurveda and the way the food treats the body. Right? Ayurveda is like an experience, okay, experience talking over there. But whereas allopathy, when we study biochemistry and the properties of sugar, it is the knowledge which is speaking. So brain versus heart. So you need to differentiate between the two. For those people who got confused, because this is a profound point, but I think most of you might could be missing out on this. So that's why I added a clarification. Thank you.
Thank you, sir.
Sir.
I was
Thank you.
about to say that, because I have a book where it talks about only alkaline and acidic diet, pH, all about acid-base balance, where the author says the sugars are acidic. So when you understand that this person is experiencing the pH of acidic in nature, then try to avoid sugars. So I know that I was trying to merge Ayurvedic and modern nutrition, but still I would like to know how does this Ayurvedic thing and see, for me again, as he said, my brain is still processing. See, sugar by itself, by nature, it is acidic only.
Let me put it in another word. In Ayurveda, there are two terms: pre-digestion and post-absorption pH.
Okay. Yeah.
So pre-digestion acidic, post-absorption it is alkaline.
Okay.
Okay. So when we are talking in terms of that, I am like most of times I am talking about the post-absorption part of it.
Got it. Got it.
Okay. So
Right.
it's the what we call plasma that is generated by a sweet thing would be always alkaline. So I was talking about the post-absorption wala part.
So this we can very much relate with the lemon, right? Lemon
Yeah,
basically it is
right.
acidic, but it once it enters our internal environment, it becomes alkaline.
It turns into a it has a lesser pH comparative to the rest of the thing.
Comparative. Yes. Yeah.
Right.
Thank you.
Right. Thank you so
Yes.
much, sir. Thank you. Thank you.
Thank you, sir.
Some-
Sambodhi, yes. Where is she? Yeah. Sambodhi.
Yes, ma'am. Regarding to this discussion only, you only told me, and that's why I lowered my hand because I also knew that all the citrus fruits, I mean lemon or oranges or mosambi or whatever. So all the citric fruits, when it goes inside, it's behaves like alkaline, right? So you said no, amla that regarding the osteoporosis, whoever has osteoporosis, they should not take it. But amla is also rich in like vitamin C, so it's like acidic in nature. But when it goes inside, shouldn't it be like acting as
There are-
alkaline? Or?
Get that, Soumya. There are herbs which are balancing post digestion also, post absorption also. So amla has a balancing property. Okay. But people who already have a cold temperament, right? Now, can literally relate this to the person's temperament also. So when they have a colder
Okay.
temperament, say for example, we have these five elements: the fire, air,
Yeah.
water, earth,
Yeah.
and space. So anybody who has more of water element should not have amla.
Okay.
Okay.
And
So
how
that
to
again,
understand that, ma'am? Like water elements are there, and yeah.
I have to get into that zone again. So let's not do that here. Okay.
We can have a
But
separate session, ma'am.
we can have a separate session. But this lady, since I know it, she was having more of air and water element. So that's why
Okay.
we are dealing in that part.
Okay.
Okay.
Thank you.
I think Sambodhi, to an extent, this Prakriti assessment can help us guide to an extent. I mean, right now, but probably we have to have deeper knowledge. Yeah, but that assessment really
True
works. Yes, Soumya.
True that.
Hi, Neelam, ma'am.
Hi, Soumya.
Ma'am, you said that this person has sugar levels around 450, like that. Is it one reading around or like
No, 200, not 400.
200,
250.
250? Okay, 250 like that.
See, her HbA1c was 6.3,
Hmm.
right? So we
Yeah.
initially asked her to test her fasting sugar at home.
Okay.
So the very first reading it was 250.
Okay.
Okay.
And
And then
postprandial
when I
leave?
asked, sorry?
I mean, post lunch or postprandial leave?
Oh, that was always stable. That was
Is that
hardly
stable?
50 to 60 point increase, not much.
Oh,
Only the
okay.
fasting was going high because her late night dinners were
Correct,
problem.
correct. Hmm.
Right. Even if
Right.
she was eating rice and everything, it
Hmm.
only rise up to 20 points, not beyond that. So we had to only focus on the fasting sugar part.
Okay. And what was her hemoglobin level, ma'am? Her
12.1. 12.1.
which is good.
Which is
Actually.
absolutely perfect. It is absolutely perfect. That's why I was worried that how come if, even if her HbA levels are okay, there was no problem with her RBCs and everything. Why is she having this UIBC and TIBC problems? The transferrin problem.
Okay.
So that led me to the protein intake of the body.
Okay. What I'm thinking is maybe the HbA1c could have been even more on a higher side since this transferrin is not happening much. I think which did not lead to having these glycated end products. In one way, it is saving her maybe.
Possibly,
Right?
possibly.
Yeah.
Or else probably her water intake was less. That's also that was another reason why sugar levels are high.
Yeah, that is there. But since this
Right.
is not because lack of this hemoglobin and all, because transferrin is not there, maybe this glucose and this hemoglobin interaction would have been less. That's why, the HbA1c is also on the lower end.
Absolutely, absolutely. That's
Mhm.
relatable.
Right, right. Yeah, that's all, ma'am. Yeah, thank you. Thanks a lot.
Thank you, Soumya. Good point.
Neelam,
Ma'am,
I have one more question. Sorry, Srishti, one more question. Um, so she used to have a dinner at 11, right? And what was the time she used to do the fasting? I mean, 2:50, when was it recorded?
Again, she used to do it at 11. So 10
11.
or 11 o'clock was the time when she used to do
Okay.
fasting.
So
So
12 hours
10
of
hour gap was
fasting, still
maintained.
it was, okay, right.
Yeah, yeah.
Even
Because
then also
again,
it
the
is
point is
2:50.
she was taking late dinner. Then she was sleeping immediately after the dinner, like 11:30, 12ish.
Hmm.
And the worst case was that she was unable to sleep properly because of the back issue.
Hmm. Right.
Right? So sleep deprivation was another reason for high values of sugar.
Sleep is always like the very crucial part.
Oh, I'll tell you one more case. Just happened today. I'll tell you what happened later on. Srishti, you have a question for me?
yes, ma'am. Ma'am, how was the digestion of the lady? It was okay.
Can you elaborate digestion? Because for me,
Ma'am,
digestion are
like
two different.
the frequency of the stool means she was constipated or the digestion
No,
was
no, no, no.
she was
She had a good
evacuating completely.
aram se, aram se. If not in the
Okay.
morning, by afternoon, yes, she was able to do that. So
Okay.
constipation never was a problem.
So, ma'am, I wanted to ask. Recently, I have read an article from a gynecologist that she was telling about the people she was meeting during her OPD. That mostly people are, I mean, under the impression that taking high amount of fiber like crude fiber or hard fiber like isabgol or salads like crunchy vegetables like green vegetables and carrots and all stuff. It further dehydrates the body and it further creates constipation. That is why she was telling that mostly people do get carried away with the videos of dietitians that take more amount of fiber and they further creates constipation and comes to me with more bloating and bowel syndromes and dysbiosis. So she was telling that in spite of increasing the hydration level of these people, I mean they should avoid higher amount of fiber. So ma'am, I just wanted to ask what is your take on this, ma'am?
Okay, Srishti, I'll answer this in again Ayurvedic form. There are people who have water element and air element which can cause constipation. Okay. So
Yes,
when
ma'am.
air element is higher, you can have constipation, and if you eat raw vegetables, the air element goes further higher. Srishti, am I
Yes,
clear on
yes,
this?
yes, ma'am. Yes, ma'am.
So yes, the crunchy food always creates a problem to the people who have the problem of more air element. Okay. So for
Okay,
these
ma'am.
people, I would never recommend trifala or this raw vegetables. I would add a spoon of olive oil to them into their vegetables and make saute it. One option. Second option, there are people who have had an episode of chronic constipation. For them, I start my day with 1 teaspoon of desi ghee or castor oil, whatever they can consume. Okay. So in that case, yes, we would still give them raw vegetables, but we would top it with sesame seeds. So sesame seeds would act as the soluble fiber for them. So we would do a combination of soluble insoluble fiber. We would do a combination of oiling or steaming. We would do a combination of water soaked with some herbs in it. Say, for example, pudina added to water would help them reduce the problems. Okay. So again, all these things are case based. Okay,
Okay,
Sushi. So
ma'am.
yes,
Okay, ma'am.
recommending fiber has to be taken care of by previously studying what kind of a meal they had been consumed. Okay, Sushi.
Okay, okay, ma'am. Thank you so much, ma'am.
Great. Thank you. And another thing, just to highlight, never recommend these people to eat salads separately. I always ask them to have their salads with their meals. So have your salad first and then have your meal. So that would eventually
Right,
end up combining the soluble and insoluble fiber both.
right, ma'am. Right. Thank you,
Thank you.
ma'am.
Anything else?
Okay, so any other questions? I guess, yeah, it's very clear, and we had good discussion today. So thank you so much, Neelam, for bringing up this iron profile thing.
Thank you so much. Vipra. Okay, guys, one thing that I was telling is there are times when if you identify the root cause, you can easily find the solution. So the guy I was today, the example that I was telling, I had been giving this person Triphala randomly that you take Triphala and you will be okay. This guy also have a diabetes history. So yeah, yesterday what happened is in spite of having Triphala, he could not poop out for 2-3 days. Okay. So what I had given him yesterday night, as I said, a teaspoon of this castor oil, and morning he had a perfect bubble movement. So all the herbs would not work for everybody, right? You have to keep yourself updated and modify things as per the feedbacks that the clients give. So for that guy, Triphala did not work. Okay, change the herb, give something else. If it is not working, then change to something else. So this guy, even what we did is yesterday night, I asked him to eat rabdi. Rabdi is that milk-based sweet which is prepared in North India. Post that after 2 hours, I asked him to have this castor oil, and morning he had a perfect bubble movement after 3 days. No pressure, nothing. He had a good thing, right? So things has to be modified. We have to take care of that. We cannot stick to one thing fit all.
That's so true. For some people, exclusively nutrition, like I can say, like this modern nutrition works. For some people, I have to go about with this Ayurvedic principle as well. So I have to check whether they have what dominant prakriti they are having. I have to balance that or pacify that doshas need to work. It depends, like but as time progresses, we will be able to understand. Okay, this client, it is not, they are not setting into that. Uh, as you said, one size doesn't fit all. So it comes with kind of intuition, kind of experience, and that's so true. I really believe so. Previously, I never believed into Ayurvedic that so in depth because I never knew about it. But now, after attending 1 or 2 sessions about Ayurvedic classes, now I'm able to sense a lot of connectivity. So, thank you so much, Neelam. So, I guess there's no queries. If you still have queries, please post it in the group. Neelam will be happy to answer it. And we will catch up with another interesting case presentation next Monday. And we are winding off for today. Thank you so much. Thank you, Neelam. Bye bye.